Welcome back to Diabetic Fit Files, where we take what happens inside the diabetic foot ulcer, open the file up all the way down to the cellular and molecular level. So today we're going to be talking about something surprisingly simple, that is copper. Yes, the copper metal. We know copper as that reddish brown. Let's say brown, I guess, reddish orange metal that is used for electrical wiring, plumbing, architecture, and coins. But inside the human body, copper is something completely different. It is an essential trace element. And when we're talking about wound healing, copper becomes incredibly interesting because it doesn't just have just one job. Copper, the trace element, the essential trace element, participates in angiogenesis, collagen formation, extracellular matrix modeling, cellular signaling, inflammation, and antimicrobial activity. So, today we're going to talk about a very important question. Can copper help heal diabetic foot ulcers? And more importantly, because there's even socks that have copper in it, but more importantly, how could a metal influence the biology of a diabetic foot ulcer? So, this is the chemistry behind it. So, as we know, the diabetic foot ulcer is a biological problem. So, before we talk about copper, we have to understand what we're trying to fix. As we know, the diabetic foot ulcer is simply not just a hole in the skin, it is a failure of normal wound healing. So, normally we know that after injury, the body moves through this organized sequence of wound healing, which is hemostasis, inflammation, proliferation, and remodeling. Blood vessels respond, immune cells and the immune cells arrive. Fibroblasts begin producing extracellular matrix. The endothelial cells form new blood vessels. Keratinocytes migrate across the wound. Collagen is deposited and remodeled, and eventually the tissue becomes new. Okay, there's new tissue. But in diabetes, it can disrupt almost every part of the process. That's why it's a big deal. So we can have, endothelial dysfunction in a diabetic foot ulcer, impaired angiogenesis. That's why we love me some vascular, peripheral neuropathy, ischemia, abnormal inflammation, oxidative stress, impaired fibroblast function, impaired collagen remodeling, and increased risk infection, biofilm, and mechanical pressure that continues to traumatize the wound. And this is what creates that chronic wound that we see so often. And the wound becomes pretty much chronically stuck, okay? So it isn't just simply failing to close, it's failing to transition through the normal biological sequence of wound healing. And this is where copper becomes quite interesting. So let's talk about copper. Let me copper. The copper is element 29, okay? The symbol is Cu. So biologically, copper is primarily important because it exists in pretty much a few different oxidation states. The two most important are Cu plus and Cu2 plus. So that's the ability to move between oxidation states means that copper can participate in electron transfer reactions. And if anybody ever knows about chemistry, oh well. But that's one of the fundamental reasons copper is biologically active. Copper isn't just sitting inside tissue. It can participate in enzymatic reactions and cellular signaling, and it acts as a cofactor in quite a few multiple enzymes. And those enzymes can be involved in processes ranging from energy metabolism to connective tissue formation. And that's a very important caveat. So, copper is a classic example of biology, chemistry, where the dose matters. And we need copper. We all need copper. And too little can impair the biological processes, and too much excessive free copper can become toxic. So, because copper redox chemistry can also contribute to oxidative damage. This is when researchers they investigate copper for wound healing, and they're not simply asking how much copper can we put on a wound, right? Please no. Okay, like I said, make comments uncommon. This is for education purposes, okay? But they're asking, can we deliver the right amount of copper to the right amount of place at the right time? Okay, so this distinction is quite critical. I don't participate or ask anybody to self-help or self-treat or self-experiment. I don't do that, okay? So copper and blood vessels, okay? So angiogenesis. We love us some angiogenesis, okay? So angiogenesis, what is it? It's the formation of new blood vessels. And in chronic diabetic foot ulcers, these chronic wounds desperately need new blood vessels. That's why we love vascular so much. Vascular, vascular. So why? Because healing requires oxygen, nutrients, immune cell trafficking, and removal of metabolic waste. And if the tissue doesn't receive adequate blood flow, everything goes downstream and it pretty much becomes difficult. And diabetes does impair angiogenesis, okay? One of the pathways that becomes particularly important here involves HIF1 alpha, okay? I did a whole episode on this, okay? So think of HIF1 alpha as one of the part cell's response systems to low oxygen. And when the tissue becomes hypoxic, HIF1 alpha helps activate those genes involved in adapting to the environment. And then one of the most important downstream signals of this is VEGF. VEGF is vascular endothelial growth factor. And vascular endothelial growth factor tells endothelial cells we need new blood vessels here. And conceptually, hypoxia will activate the HIF1 alpha, and that will cause VEGF, and that will cause an endothelial response, and that will cause angiogenesis. But here's the fascinating part: diabetic wounds can have hypoxia while simultaneously having impaired hypoxic response. So the wound can essentially say, I do not have enough oxygen, but the cellular signaling machinery of that diabetic foot ulcer isn't responding appropriately. So researchers that suggest that copper can influence the HIF1 alpha stabilization and the VEGF associated angiogenic signaling. And this gives us a very interesting pathway. So copper will cause the HIF1 alpha signaling, which will cause the VEGF and which will result in angiogenesis. Now, that does not mean that copper magically creates blood vessels. Absolutely not. It means that copper can participate in a molecular pathway that helps regulate angiogenesis. So those are two very different things, and that is more scientifically accurate in that way. So why does angiogenesis matter for us when it comes to the diabetic foot? So imagine you have a plantar diabetic foot ulcer. The patient has neuropathy, has been walking on the wound, the tissues are inflamed, the wound has a high metabolic demand, and the microcirculation isn't functioning normally. So the wound needs oxygen. It needs nutrients, it needs immune cells, it needs fibroblasts, it needs endothelial cells, it needs collagen production, it needs epithelialization, it needs infrastructure, and the infrastructure for that ulcer is not there. That's why limb preservation isn't simply just putting something on a wound. We're asking, does this foot have the biological and the mechanical conditions necessary to heal? And copper is interesting because it's one of the biological pathways. It can influence the formation of the vascular infrastructure. So copper and collagen, okay? So collagen is one of the most important proteins when it comes to wound repair. But producing collagen isn't the end of the story. Collagen has to be organized, collagen has to be cross-linked. And that brings us to an enzyme called lysyl oxidase. So lysyl oxidase is copper dependent. Its job is incredibly important. It catalyzes oxidative deamination of a specific lysine residues of or in sorry in collagen and elastin, okay, and that begins the process of cross-linking these structural proteins. So in simple terms, copper helps activate the chemistry that allows collagen and elastin to become mechanically stronger. So think about the wound as a construction site. Like we said, the fibroblasts are the ones that are producing the building materials, and the collagen is being laid down. But the structure needs reinforcement. So copper dependent lysyl oxidase participates in this reinforcement process. So copper will result in the lysyl oxidase, which will result in the collagen slash elastin cross linking, and that will help with the extracellular matrix integrity. So that helps, okay? So let's elaborate a little bit more on that extracellular matrix. So the extracellular matrix is the environment surrounding the cell, right? It's not just a biological scaffold, it's communicating with the cells. It influences cell migration, it affects tissue architecture, it provides structural support, and it changes continuously during the wound healing phases. And copper participates in this process involved in extracellular matrix maturation and remodeling. And that becomes particularly important in chronic wounds because diabetic foot ulcers aren't simply just about producing more collagen. It's about producing and remodeling the matrix appropriately. So, too little matrix formation is a problem, but abnormal or excessive matrix remodeling can also be a problem. So, that's why healing is such a balanced act. And copper is one of the micronutrients involved in that balance. Now, let's talk about one of my favorite cells, which are the fibroblasts, okay? Fibroblasts are some of the major workers in the proliferative phase of wound healing, which is my favorite phase. And they produce the components of the extracellular matrix. They participate in the granulation tissue formation, they respond to growth factors, and their activity is essentially for rebuilding the damaged tissue. But copper can influence that cellular signaling involved in the pathways associated with fibroblast function and tissue repair. Now, we have blood vessels, we have fibroblasts, we have collagen, and we have extracellular matrix. But there's another problem we can't ignore, the microbes, okay? So how does copper affect the microbes, like the bacteria? So as we know, most chronic diabetic foot ulcers are polymicrobial, right? They become this environment or ecosystem for these microorganisms, right? They become colonized. And under certain circumstances, bacteria can contribute to an infection and biofilm formation, right? But copper has another fascinating property. It has an antimicrobial activity. So the copper ions can interact with microbial membranes, proteins, and other cellular components. And copper redox chemistry can contribute to the oxidative stress within those microorganisms. And copper containing materials can interfere with the essential microbial processes. So, copper can have multiple actually antimicrobial mechanisms, right? But here's the important thing, okay? You have to understand that copper is not an antibiotic. Absolutely not, okay? So we shouldn't present it as though it replaces the appropriate management for infection, okay? A diabetic foot ulcer that has infection requires clinical assessment. And, if it's a deep infection with abscess or necrotizing infection or osteomyelitis or significant ischemia, copper dressings are not going to solve anything when it comes to that, okay? So copper antimicrobial properties are quite interesting because they may provide another layer of protection or microbial control within a certain wound care technology, okay? But they're going to be more adjunctive, right? Now, copper with biofilm. We already know biofilm is one of the reasons chronic wounds can be so difficult. So, bacteria can organize itself within this protective extracellular environment, and the environment can become more difficult to eradicate because of the secondary to the biofilm. So, the wound then exists in this persistent inflammatory state. And copper containing materials are being investigated because their antimicrobial mechanisms may interfere with the microorganisms at the wound surface. But yet again, the antimicrobial activity in the laboratory does not automatically equivalent to clinical wound healing. Okay, and that's a very crucial distinction to remember. But when evaluating any wound care technology, people need to ask, does it improve the outcome in actual patients? Not simply does it kill bacteria on a petri dish. So that's the difference between interesting chemistry and actually clinical chemistry with meaningful in evidence. Forgive me. So another thing that is another fascinating development is copper nanoparticles. So when we take a material and reduce it down to a nanoscale, its surface properties can change dramatically, and you can have a much larger surface area to volume ratio, and that can influence ion release, interactions with microorganisms, interactions with cells, material behavior, and biological activity. So, researchers have been investigating copper nanoparticles in wound dressings, hydrogels, scaffolds, and other biomaterials. And the goal simply isn't just to place copper on a wound. The goal is to develop a material that can control how the copper interacts with the wound environment. So that's a big difference. Now, when it comes to copper hydrogels or controlled delivery. So imagine that hydrogel is soft, it's hydrated, it conforms to the wound. Now imagine incorporating copper into that material. A hydrogel can potentially act as a delivery platform. And instead of dumping large amounts of copper into the wound, researchers are attempting to control that. How much copper can be released and how quickly can it be released and where can it interact? And that's the concept of controlled delivery. And this is important because copper has a double personality. At appropriate biological concentrations, it can participate in healing. At excessive concentrations, it can participate in cellular toxicity as well as oxidative stress. So the future of it isn't necessarily more copper. The future sounds like it's going to be more better copper delivery. Now, when it comes to the copper paradox, copper can help generate biological activity, but at the same time, same chemistry can become harmful when it's uncontrolled. So that's why, copper participates in redox reactions, and those reactions can contribute to reactive oxygen species. And we know reactive oxygen species can damage microorganisms. That's useful, right? But excessive oxidative stress can also damage human cells. And that's where, wound healing we need living cells, right? So the challenge is how do we create enough antimicrobial as well as signaling activity without creating excessive cytotoxicity? And that's a paradox when it comes to using copper and why formulation when it comes to copper matters so much. So what do we do when we're putting copper and diabetic foot ulcer or wound together, okay? So let's put the entire pathway together. So we have a patient who has diabetes, they develop neuropathy, they don't feel the repetitive pressure, the wound develops and the wound becomes chronic. Angiogenesis is impaired, the inflammatory response is dysregulated, the fibroblasts are impaired, extracellular remodeling has been abnormal for a while. The wound becomes vulnerable to biological microbial burden. And now, if we introduce a copper containing biomaterial, potentially that has several biological effects occurring simultaneously, like I mentioned earlier, copper can participate in the HIF1 alpha as well as the VEGF signaling that can help support angiogenesis. We know that copper supports the lysyl oxidase activity, which contributes to the collagen and elastin cross-linking. We know that copper can influence the cell signaling and the fibroblast associated repair. We know that copper containing materials can provide antimicrobial activity. And instead of thinking copper equals antibacterial, we should think copper equals multifunctional biological cofactor with antimicrobial and tissue repair potential, as well as angiogenesis potential. But can copper help heal a diabetic foot ulcer? Or every diabetic foot ulcer? Absolutely not, right? So this is clinical medicine, okay? Clinical medicine remains evidence-based, okay? So if the patient has critical limb ischemia, who do we need? We need vascular, okay? If there's significant infection, we need infectious disease. We have to remove the source of infection, source control, all this stuff. If it's because of excessive pressure, we need offloading. If there's necrotic tissue, we're going to have to use and remove the necrotic and devitalized tissue as indicator, especially per vascular clearance, make sure that we're not going to cause more harm than good. And if there's osteomyelitis, you need to evaluate the bone infection appropriately and find the right treatment protocol for that, right? But if the patient has severe neuropathy, we need to address the fact that they may be continually injuring a foot that they cannot feel, right? And regardless of how sophisticated a dressing is, advanced it is, you cannot overcome untreated mechanical or vascular problem. And that's one of the biggest important lessons when it comes to diabetic foot care. Okay, every patient, I think, this is my protocol. Any patient that has diabetes needs to see the vascular doctor. Okay, if you can still feel their process, that's great, right? But they still need to see vascular. They still need to see vascular no matter what. Okay, that's my thing. Okay, so if people may think it's excessive, but that's just me, okay? I'm not for everybody. So this brings us back to limb preservation. Limb salvage isn't about one product. That's why limb salvage is so complex. That's why limb salvage isn't like a one size fit all, just one physician can do it. I think everybody should have a limb salvage specialist on their just on not just on their team, but be able to have direct contact with a limb salvage specialist just in case if the ulcer goes left so that you give the patients the best chance of keeping their foot. I actually heard something on social media. This woman said that she was giving a bad analogy, but she used a diabetic leg as a bad analogy. She said that something needs to be cut off like a bad diabetic leg. And I was like, that is so rude. But that also shows me that that is what's ingrained in what society accepts and thinks that's a norm to just cut off a patient's leg that is a diabetic. That is not a norm, okay? That should not be a norm, okay? Here's another thing. You should always do the right thing, not the fastest thing. Okay. We're living in this world of fast, a world expediation. Everything has to be quick, 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 quick. That's why people they don't have the patience. And yes, they want to amputate because it's the quickest thing. Limb salvage requires patience, creativity. Actually, you have to be kind of nice. You actually have to be very nice to do limb salvage because this is a personal thing. You require a lot of patience. It requires a lot of energy to do limb salvage, okay? You have to connect with all the different specialties, okay? And limb salvage is the right thing to do, okay? Amputation is the expedited thing to do. Sometimes it always is do the right thing, okay? Because in this world, I've noticed it's kind of sad how bad the world has gotten to the point where, I mean, people have lack of empathy, people have lack of morals. I mean, it is so rare to find somebody with integrity, morals, not rude, not a bad person. And then on top of that, it is so easy to buy people out. Like all you have to do is give them money and they'll do whatever you want. It's crazy. I did not know money does all these things just so and people will do anything for money. That's why what's happening right now, people are seeing this weird phenomenon of all these people going on, you know, fans, whatever it's called, right? Because it makes them money. But is it a society that helps people with integrity or morals or anything like that? No, they're only doing it for money and they're proud of it. That's the problem that I have. They're proud of it. Everybody's like, oh, but they make a lot of money. They can pay their own bills or whatever. But what about their morals? What about their integrity? Is this what we want our society to be built on? Okay, I'm not trying to downplay it, but it doesn't help with anybody's morality. That does not help with morality. That doesn't help with the people's mindset. It has made people worse. I have yet to meet a happy person who's done that. It doesn't help them. It doesn't help you mentally, okay? The world is lost mentally, okay? And that's the biggest problem I've noticed. Like, it seems like it's the rare thing to be a kind, honest person, somebody with integrity, somebody who doesn't lie. And something what I tell men if a man lies to me, I tell them it's a feminine trait to lie because women have to lie because they have to use their words to survive. So they lie. Men shouldn't lie. Okay? That's why men used to go to war. That's why men learned how to fence and use swords and stuff like that because they used to be able to say whatever they wanted to say and had to defend their honor. And that's why they used to say, I'm a man of their word, my word, right? Because men used to be men of their word. Now we're in this era of lying. It's weird. It's very odd. Okay. People who lie are usually very fearful. They, oh my gosh. If anybody knows me, I am a huge person when it comes to lying. I do not like liars at all. I usually cut liars off. If you lie to me once, that's it. I don't need to talk to you anymore. You're kind of like a very scary person, and honestly, you don't have enough faith in yourself or whatever you believe in, you obviously don't because you're too scared to tell the truth. Okay? That's what I believe liars are. They're very fearful. Because if you weren't fearful, you wouldn't lie. That's the truth. If you weren't fearful, you would never lie. But let me get back to the normal thing, okay? But always try to do the right thing. And I think in my opinion, limb salvage is the right thing to do. It might not be the most it wouldn't be the fastest. It might not be even the one that makes you the most money, but it is the right thing to do to help save a limb, help with patients' integrity of their life. increase the quality care of their life and make them better, okay? And that's the whole point of limb salvage, okay? Now, let me get back to it because I went into another tangent. But question is, does copper help heal wounds? We kind of went into it, but can copper improve angiogenesis? It seems like it can. Can control copper release improve granulations? Can copper-containing biomaterials reduce bioburden? And can it improve extracellular matrix maturation? And does the molecular effects translate into faster, more durable wound closure, fewer infections, fewer amputations, and better limb salvage and outcomes? Possibly, okay? But that ultimately matters on the patient and the actual source that is blocking them from healing, okay? So, in a final thought, a diabetic foot ulcer may look like a wound on the outside, but we always have to remember it's way more complex than that. Underneath a wound is an extraordinary, complicated, especially a diabetic foot ulcer, a complicated biological system, which includes blood vessels, nerve, immune cells, fibroblasts, keratinocytes, collagens, growth factors, oxygen, microorganisms, extracellular matrix, and trace elements. Copper is one of the few tiny molecules and ions that can be outsized, influenced by on its biology, okay? So it can participate in the chemistry of angiogenesis. It can support the enzymes involved in collagen and elastin maturation. It can influence cellular signaling. It can interact with microorganisms. But the lesson isn't put copper on a diabetic foot ulcer. Absolutely not. Okay. Lesson is more sophisticated than that. We have to understand the biology. We have to understand the chemistry. We have to understand the patient. We have to understand the wound. And then that helps determine whether a particular technology or adjunctive therapy is meaningful to improve the environment in which healing can occur, okay? Because in the end, when we're talking about diabetic foot ulcers, we're not trying to simply close the wound. We're trying to preserve a limb, and that's the whole point. And sometimes understanding something as small as copper can help us understand something as big as the future of wound healing. And you've been listening to Diabetic Foot Files. I'm Dr. G, and every limb has a future. And take care of your feet because they take care of you.